Good afternoon. I'm probably about 10 or 15 minutes late doing this because we were outside trying to get our Christmas decorations up. So we better get them up. December is here. So welcome to day 3 of my Be Well Birth Well birth tips. Day 3 of 20. So if you've missed it, I have day 1 and day 2 saved down into my grid. Hey Rona, how you doing? So yeah, I've done day 1 and day 2 over the last 2 days. They're saved down into my grid. They're really good. They're all about keeping your pelvis open and the importance of keeping your pelvis open and how much difference that can make to your birth. So if you haven't seen them, go back and watch those 2 videos. Yeah, they're really good. So yeah, keeping your pelvis open, probably my number 1 tip, but this one I'm going to talk about today is probably my number 2 top tip for birth. So if you give birth tomorrow even and you do these 2 things, keeping your pelvis open and breathing when you push, I guarantee it'll make a difference to your birth, huge difference. So pushing stage 2 labor, the stage where you're fully dilated and your baby is nearly there and your body is ready to push this baby out. Hey Carmel, how you doing? So what do we see, in the movies, and what happens generally speaking in most of our hospitals is that we are coached to push, okay? It's called coach pushing. Some people call it purple pushing, but we're told, okay, hold your breath now, chin into the chest, push, 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 push into your bottom. And you're told to do that all through your surge, and then, okay, breathe now, in between your contractions, and then again, hold your breath, push, 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 push into your bottom. And that is what's known as coach pushing, and it is the norm in most hospital settings. And it is not a good idea. Why? Think about it, okay? First of all, you're holding your breath for any period of time. You are limiting the amount of oxygen that you're taking into your body. Your uterus is trying to do a big old job. It's a great big muscle. It's the strongest muscle in your body at that moment. And it is trying to do this enormous job of getting your baby out, yeah? It needs oxygen. Your muscles need oxygen to work. Hey, Neve, how you doing? Your muscles need oxygen to work. Your uterus needs oxygen in order to work. Hold your breath. You're robbing your uterus of oxygen. And guess what's going to happen? This is what happened to me. Your contractions might slow down if you do that for long enough. And that happened to me in my first labor. So it robs your uterus of oxygen. It also can limit the oxygen getting to your baby, which none of us want. And it also puts enormous pressure on your perineum, that part of your body that tears sometimes during labor. And holding your breath actually increases the pressure on your perineum and makes you more likely to tear. Also, I think a lot of us, if we're trying to hold our breath and we're doing this, we clench our jaw. I do anyway, I know when I did it. And if our jaw is clenched, if our jaw is tight, our perineum is tight. There's a direct correlation between your jaw and your perineum. So that again, hey Jackie, how you doing? So that again increases your risk of tearing. So doing that purple pushing, they say purple because you go purple in the face, you're holding your breath so much. So that purple pushing or that coach pushing, hold your breath, push, push, push into your bottom, increases your risk of tearing and robs you of really vital oxygen for you and for your baby. So what's the alternative? The alternative is non-coach pushing, breathing when you push your baby out. And there's lots of breathing techniques out there, and I'm trying to keep these videos short, so I won't go into it today. I'll probably get to it eventually. But really just slow, controlled breathing. So if all you do is breathe in through your nose and breathe out nice and slowly through your mouth while you push, that's perfect. That's all you need to do. So none of this, just in through your nose and out through your mouth. It can be that simple. There are other techniques you can learn too, but it can be that. If you go into labor today or tomorrow, just do that while you push, okay? What's that going to do for you? First of all, you're going to have less pain because you're splitting your focus. You're concentrating on this breathing technique, whichever one you choose to do. So that automatically splits your focus in your brain. And once you do that, your brain can't pay as much attention to the pain. So it's going to result in less pain. You're going to have less risk of major tearing, which again, less painful in the long run because you're putting less pressure on your perineum. Slow controlled breathing calms down your nervous system, okay? So it sends a signal to your nervous system that everything is okay. If your nervous system is calm, your adrenaline production goes down and your good hormone, your oxytocin production goes up. And that's the hormone you want. That's the hormone that's helping your uterus contract. That is the hormone that is getting your baby out. So you really want that. And it's getting oxygen to your uterus so that it can do the job that it needs to do. And it's getting oxygen to your baby so your baby doesn't end up in distress. So huge advantages to breathing while you push. The other question I get asked is, well, how do you push? If you've never had a baby before and you see all the media where you have to be coached to push and told when to push and how to push and push into your bottom, you know, that everyone has this fear, well, I don't know how to do it. I don't know, I've never done it before. You don't need to know, okay? If you have, now I'm talking about normal physiological birth. So this is birth where you haven't had any induction or epidural or major drug interventions. Gas and air is fine. If you're having a normal physiological birth, there is this reflex in your body called the fetal ejection reflex. And it is basically, it's like throwing up, except you throw down, essentially. And it is your body, just your uterus just contracts to push your baby out automatically. It is an unstoppable force. It is uncontrollable. I have felt this in my own labours. And your body just does it, okay? People give birth in comas, you know, because of this. So your body just does it. In normal labour where we haven't interfered with the birth process, your body will have this fetal ejection reflex where it just takes over and you feel this massive push. Now you can, if you wish, add an extra push into your bottom on top of that push if you want to, or you don't have to. You can literally just let the fetal ejection reflex push your baby out. So you don't have to get too stressed out about, oh, I don't know how to push, I don't know how to push. It's going to do it for you. As I say, if you have an epidural, you're not feeling anything, you don't know when you're having your surges, obviously then you're going to need some coaching from your midwife as to when to push. Now in saying that, you still can breathe. So yes, you might need some coaching as to when to push and push into your bottom, etc., etc. But you can still breathe while you do that in an epidural situation. So just to make that clear. So yeah, that's it really. Breathe and add that little push into your bottom as well if you want to do that. But breathe is my tip. You know, research says there may be slightly longer, 10 to 15 minutes, the research is a bit dodgy on this. You may have a slightly longer labour if you don't do that, adding that extra push into your bottom, holding your breath business. But you know what? You'll have possibly an intact perineum. So, you know, I know which I would rather have at the end of the day. I'd rather do the extra 10 minutes, if it even is, and it's the jury's out on whether that's even true. But I would rather breathe and you have that last an extra 10 minutes and have an intact perineum coming out of it. But it's up to you at the end of the day. So that's my tip for today. Do join me tomorrow for the next installment, and I'll see you then.